Hi, I'm Lauren Massey, physical therapist and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about tennis elbow and golfer's elbow and some of the causes and treatments of those pathologies. So first of all, those terms are the layperson terms for something otherwise known as medial or lateral epicondylitis. So what does that mean? Elbow pain. So lateral epicondylitis, lateral means the outer side, medial being the inner side, and the epicondyle is the bony projections on either side of the elbow. When we talk about epicondylitis, itis means inflammation. So backing up to make sure we have all the definitions correct, this is commonly when the tendons of the muscles of our forearms, which insert into that area, become irritated and inflamed. So a tendon connects muscle to bone. So our forearm extensor muscles here on this surface insert to the lateral epicondyle, that bone right here. And our flexor muscles here on this side turn into tendons, which insert on the medial epicondyle. So now that we have some definitions, another thing you might hear instead of epicondylitis would be epicondylosis. So osis is a more chronic condition, meaning you've probably had this a while, your body's starting to kind of ignore it, but you are still feeling chronic symptoms of it. So once we figure out what's going on and which tendons are affected, we need to figure out where do we go from here to decide treatment. Now, a lot of times we're going to ask you, what were you doing before this, or was there any change in your activity? And as the names originally suggested, the tennis elbow or golfer's elbow, it is much more common for people who play tennis to feel pain on that outer aspect due to the wrist motions of, say, a backhand in tennis, and golfers to feel it more on the medial side due to the follow-through of their swing. Now, does that mean that those are the only people who get this condition? Certainly not. You don't even have to be playing those sports to experience these things. Sometimes people who have gripping tasks in their jobs, manual laborers, sometimes even just typing at your desk can cause an overuse, usually tied into poor posture and poor ergonomics. And that's our job as your physical therapist to make sure we evaluate all of these things and look at the whole picture. We also need to decide, to be able to give you better information, whether it's okay to push through some of the discomfort or whether we need to tell you to back off or modify activity. One thing that we have access to here is musculoskeletal ultrasound. So that is an ultrasound which allows me to see the integrity of your tendon, where I can look and say, hey, is there inflammation in this area? Is there any micro tearing, or is there a more significant tear that would require complete rest? So we oftentimes will encourage making sure that we know the integrity before we tell you how to proceed. Sometimes you'll hear people get cortisone injections to help treat these elbow itises. And again, sometimes cortisone can be the correct solution for you, but sometimes we might recommend against it based on what we see in that ultrasound. So for example, we know that cortisone can weaken tissue. Those cortisone injections are often provided with a bit of a painkiller, which is why people feel some relief, but it might not always last. If you are someone who we determine has some micro tearing or even more significant tearing in the elbow, I might be hesitant to recommend you rush off to get that cortisone injection, because I don't want the cortisone to further weaken the tissue and put you at risk of any more serious tearing or damage. There are other injections that your doctors might recommend, including PRP injections. But as our motto goes here, we always want to try to heal you with conservative care first. So what does that mean for physical therapy? Well, as I mentioned earlier, we're going to look at what got you here. We're going to look at the ergonomics, maybe even the sporting mechanics, if you are playing sports that could have contributed. We're going to make sure that you have the flexibility in those tissues, might give you some stretching exercises, and provide some soft tissue massage to decrease the stresses that are put into the bones where those tendons insert. And oftentimes, we're going to strengthen muscles closer to your trunk, your shoulder muscles, your back muscles, to again decrease the stress on those small muscles into the elbow. If you are having too much pain, we're lucky enough to have a modality called a Class 4 laser that can help decrease that inflammation, decrease the pain, to be able to allow you to better participate in physical therapy. If you would like more information on our Class 4 laser, please see our vlog entitled How a Warm Healing Laser Can Improve Physical Therapy Results. After we've decided that we are ready to go, modified any activities, and taught you all that we can, we hope to get you back to function as soon as possible and make sure that this pain stays away. If you need any help healing your golfer's or tennis elbow, please give us a call and set up a complimentary consultation today. Thank you.